see if he would require dialysis. Obviously, I would escalate this to my consultant, so they're aware of this patient and any other measures we need to take. I don't know the definitive treatment of myeloma, but that is something I would discuss with my consultant further.
Okay. Is there anything else that you would like to add in this case?
In this case, I should have also mentioned, sorry, for the kidney, making sure they're well hydrated, so just the basic management and any infections, treating that as well. And I guess this patient would need to be discussed in an MDT meeting also.
So you have demonstrated that you are able to follow a structure. You've gone through history, examination, investigations, and management in a very good order. So you not only showed the ability to manage AKI, investigate, could it be urine retention, could it be infection, could it be medications induced, that it shows that you have got very good basic knowledge. And that it ties in well with the myeloma, because we also mentioned some of the other potential.
And then I think in anything in medicine, whatever exam or assessment you're doing, talking to people who've been through the process helps. So for me, it was a little bit harder because it's a bit of a niche speciality. So that's something that Optimise helped with a lot. You're able to put me in contact with somebody who had done, medical oncology interview before. And there is a lot of overlap with MedOnc and ClinOnc, which is really useful because when you're preparing, it's not like preparing for two completely separate specialities with their own issue. There's a lot of overlap. But then for me, I was just being mindful of what are more MedOnc points and what are more ClinOnc points. Yeah. And you need to know what to stress in each interview, to be honest, to give yourself the best chance in each. And I felt like going through the interview process once prepared me for the other one as well. So I was a big fan of having more than one interview because I think it's a good process to go through. And then, so I think mixed methods is unbelievably useful for me. So there's the interview book. There's like the book that you guys recommend to use. It's the Guide to Medical Interviews, and that'll show you your structures for how to answer questions, and that's really really important advice, and also give you a lot of common scenarios that come up across all medical interviews across your whole career. So that's really useful. And then there's the conversations you have with people who've gone through the process. And then there's courses such as Optimise, which I enjoyed. Again, I wasn't really an oncology theme until this year, so that was something that I got to experience with Paolo, who helped me through that. Doing the mock interview helped as well with the pacing. And then having that real-time feedback on your performance, I think, showed me.
For the next video, we're actually going to cover tumor lysis syndrome. So this is something that some of you may have encountered if you worked in a haematology or oncology job during your IMT training. So just to start off with, in terms of the definition, tumor lysis syndrome, or TLS, is a metabolic syndrome which is caused by the breakdown of malignant cells. What we tend to see is that this usually occurs at the start or during chemotherapy in very active disease. So this is normally seen in patients who present with a new diagnosis, or in those patients known to us who then progress or change into a more aggressive form of their disease. And therefore, there can be quite significant morbidity and mortality associated with this condition. So prevention is key.